Hi, welcome to today's episode of Kids Town Corner. We're going to follow up today on what we talked about last time, which is what we need as part of our team approach. We do the procedures. We need mom or dad to help us, or even the child help us with the recovery to get our best possible outcomes from a lip tie or tongue tie procedure.
One of the things that happens most often following a lip tie or a tongue tie, one of the things that can happen, I should say, is that it can actually reattach. So Dr. Brett and I might go in with the laser and we might remove that tissue and cut it back. But over time, as the wound heals, sometimes the body will naturally go back to the state it was in before we did anything, and that lip tie or that tongue tie could actually reattach itself.
Yeah, and when it does that, you know, there's a healthy level of reattachment that's up higher, that's staying out of the way. So like on the tongue, our tongue's got to stay attached, right? If it doesn't, we've got a big problem. But we don't want it clear up to the tip like it was. So it's going to reattach at some level. We just don't want it as far up or even worse than it was before. Same with the lip tie. That attachment, a lot of times when we're doing those, is clear down. It's going to reattach somewhere because that lip's got to stay intact, but we just don't want it coming down as far or further than before. We talked about that wound being like a diamond last time. If you think about that diamond when you lift up the lip, when that lip comes down, that diamond folds over itself. So you think of that beautiful, healthy, clean tissue that we just took care of with the laser, and if it lays on itself, you can think of if you had a wound on your elbow, or you're right here in the right by your elbow on the inside of your arm, and if you had a scab there and you just left your arm like this the whole time, it would heal up, and if you tried to open that, it would hurt, and that scab would attach to the other side because it's folded over. Same thing happens here, and same thing under the tongue. So we've got some exercises that we have you do, stretches really, that we have you do with your child, whether it's your infant, your toddler, or your older child at home, that have to happen in order for us to have good success. And we know that at the first week follow-up, if that's happened or not, because we can tell if there's been reattachment. So we'll talk a little bit about those stretches and that.
So with the lip attachment, you'll basically take that upper lip and you'll stretch it out. You know, you can do it at the same time that you're brushing the teeth. You're in there, you're brushing their teeth. As soon as you're done, you'll grab their upper lip and you'll just kind of pull on it and stretch it out. Make sure, like Dr. Brett said, that it's just not setting up against itself without any movement. And don't be nervous. If you grab that lip and you kind of start stretching it out, you may get a little bit of bleeding.
Yeah.
But again, that just means that you're basically breaking that reattachment that's trying to take place. So we'll have you pull on the lip and kind of stretch it out and make sure that it's moving, and that that'll help minimize and make sure that we're getting a healthy level of reattachment, like Dr. Brett said, and that it's not coming down as far as it was when we originally did the procedure.
Absolutely. Another thing is, how do you stretch the tongue? That's hard, and like an infant, that can be difficult. I mean, a lot of times when they're feeding and things, that tongue's can be moving, so it'll help. But it's actually, the little technique is to get your fingers underneath their tongue and kind of lift up. Think of what would stretch your tongue. Sticking it out far, you can't get a little one to do that, they don't understand. If they're old enough, if it's a tongue tie on an older kid, you can have them stretch their tongue out as far as they can to each side, and that's pretty much their stretches. But curling it back is the big one. So you think of when you do that, it stretches your tongue. So you're trying to curl your infant's tongue back. You kind of get your fingers on there and just push back. And that's the stretch there. And with the infants, the rule of thumb there is when they're with their feedings. So you can decide before or after their feedings what works best to do their little exercises, their stretches. So if they've got a lip tie, you know, pulling their lip out and stretching it, lifting it up, anything that would stretch it, and then that tongue tie, that little lift and curl. If you're doing that at each feeding, you're totally good. After that first week at the consult, we will check for reattachment, and the way we check is with a stretch. And so, like Dr. Wren said, if we do a stretch and it doesn't bleed, we win. You know, you did a great job, the stretching's worked, we don't see any bleeding, no reattachment. But if we pull on the lip and it's giving some resistance and we see a little bit of bleeding around the edges, then we know we've got some reattachment, and then we've got to go from there and see what we need to do.
So You know, one other thing to keep in mind, just kind of keeping it comfortable as it's healing, is in the front of the mouth. When we eat, we usually use that area of our mouth just to kind of tear the food off. Once we've torn a piece of the food off, then we normally go back to the back of the mouth and do all of our chewing. So one of the things you can kind of do to help them keep comfortable as they're healing and as you're doing the exercises is you can cut their food into smaller pieces that they can take back directly to the back of the mouth and do all of their chewing back there, and that'll kind of help you in that first week from the time that we do the procedure till we do our follow-up, to kind of help keep them comfortable and to make sure that we get as good as outcome as possible.
Absolutely. So from this video, you probably learned this is definitely a team approach. I mean, cavities are a team approach as well. You know, we need people to be brushing and doing their thing at home. We can't do it all. Same thing comes with the lip tie or tongue tie procedures. We can do our part, but we absolutely need a team approach with mom or dad to do these stretches so we have the best outcome possible. If we have that, we can get great outcomes to where the healing looks awesome. We've taken care of the issue. We've got a kiddo that's feeding better. We have a kiddo that's speaking better. We have a kiddo that's been able to brush their teeth better up top without pain. Or we've got a better outcome as far as orthodontics. So there's a lot of great benefits to these, doing these frenectomies, these tongue tie or lip tie revisions. We'd be happy to consult with you. If you think that your child has any issue with these, please come in and check it out. We hope this video is especially helpful for those moms or dads that have had this procedure done with us, and we've gone over what to do when you get home. So this is mostly for you, hopefully for everybody else too. Hopefully it was educational. If there's questions or comments, please put them below. Thanks for joining us.